What is the primary philosophical principle that distinguishes osteopathic medicine from allopathic medicine? A. Osteopathic physicians only use manipulation techniques. The body is a unit. The person is a unit of body, mind, and spirit with inherent self-healing mechanisms. C. Osteopathic physicians do not prescribe medications. D. Osteopathic medicine focuses exclusively on musculoskeletal conditions. 2. According to the AOA's standards for osteopathic medical education, what is the minimum number of hours of osteopathic principles in practice, OPP instruction required? A. 50 hours. B. 100 hours. C. 200 hours. D. 300 hours. 3. Which adult learning principle is most important when teaching osteopathic manipulative treatment, OMT, to medical students? A. Lecture-based instruction is superior to hands-on practice. B. Students learn best through kinesthetic, experiential learning with immediate feedback. C. Theoretical knowledge should precede all practical application. D. Standardized patients are unnecessary for skill development. 4. What does the acronym comlex stand for in osteopathic medical education? A. Comprehensive Osteopathic Medical Licensing Examination. B. Committee on Medical Licensure Excellence. C. Clinical Osteopathic Medical Level Examination. D. Certified Osteopathic Medical Learning Experience. 5. In the context of the AOA's osteopathic core competencies, what does osteopathic philosophy and osteopathic manipulative medicine specifically require of residents? A. Only learning manipulation techniques. Understanding and applying osteopathic philosophy and appropriate use of OMT in patient care. C. Avoiding all pharmaceutical interventions. D. Focusing solely on primary care specialties. 6. Which teaching method is most effective for demonstrating palpatory diagnosis skills in osteopathic medical education? A. Video demonstrations only. B. Written descriptions of tissue texture changes. C. Direct faculty-guided hands-on practice with immediate corrective feedback. D. Online simulation software exclusively. 7. What is the primary purpose of the AOA's Continuing Medical Education CME requirements for osteopathic physicians? A. To generate revenue for the organization. B. To ensure physicians maintain competency and stay current with medical advances. C. To punish physicians who don't comply. D. To promote only osteopathic-specific treatments. 8. According to osteopathic principles, what does the concept of structure and function are reciprocally interrelated mean? A. Anatomy and physiology are completely separate entities. B. Alterations in bodily structure can affect function, and dysfunction can lead to structural changes. C. Only surgical interventions can correct structural problems. D. Function has no relationship to anatomical structure. 9. When developing a curriculum for osteopathic graduate medical education, which accrediting body standards must be followed? Only B. ACGME and AOA through the single accreditation system. C. State medical boards exclusively. D. Individual hospital policies only. 10. What is the primary goal of the 5 models of osteopathic care in clinical practice? A. To limit treatment options. B. To provide a framework for applying osteopathic philosophy to patient care. C. To replace evidence-based medicine. D. To focus only on manipulation. 11. In osteopathic medical education, what is the purpose of formative assessment in teaching OMT skills? A. To assign final grades only. B. To provide ongoing feedback during learning to improve technique and understanding. C. To eliminate struggling students. D. To compare students against each other. 12. Which communication technique is essential when obtaining informed consent for osteopathic manipulative treatment? A. Using complex medical terminology to demonstrate expertise. B. Clearly explaining the procedure, benefits, risks, and alternatives in understandable language. C. Assuming the patient understands without asking questions. D. Providing consent forms without verbal explanation. 13. What does AOA approved mean in the context of osteopathic medical education programs? A. Programs that only teach manipulation. B. Programs that meet AOA standards for osteopathic medical education and training. C. Programs that exclude allopathic medical knowledge. D. Programs that are less rigorous than LCME accredited programs. 14. According to adult learning theory, why is case-based learning particularly effective in osteopathic medical education? A. It requires less preparation from faculty. B. It allows students to apply osteopathic principles to realistic clinical scenarios, enhancing retention and transfer. C. It eliminates the need for hands-on practice. D. It focuses only on memorization. 15. What is the primary ethical consideration when teaching students to perform OMT on real patients? A. Always prioritize learning over patient comfort. B. Ensure adequate supervision, patient consent, and that student skill level is appropriate for the intervention. C. Students should practice without faculty oversight to build independence. D. Patient safety is secondary to educational objectives. 16. In the context of regulatory compliance, what must osteopathic physicians document when performing OMT in patient records? A. Nothing, as OMT is not considered a billable procedure. The regions treated, techniques used, patient response, and medical necessity. C. Only the time spent on treatment. D. Documentation is optional for OMT. Which osteopathic tenet emphasizes the body's inherent ability to heal itself? A. The body has no natural healing mechanisms. B. The body possesses self-regulatory and self-healing mechanisms. C. Only external interventions can promote healing. Healing requires pharmaceutical intervention exclusively. 18. What is the purpose of the Comlex USA Level 1 examination? To test only manipulation techniques. B. To assess whether medical students understand and can apply foundational biomechanical and osteopathic medical knowledge. C. To replace clinical rotations. D. To determine specialty choice. 19. When mentoring osteopathic medical students, what approach is most effective for developing clinical reasoning skills? A. Providing all answers immediately without allowing student thinking time. B. Using Socratic questioning to guide students through diagnostic and treatment reasoning processes. C. Criticizing errors publicly to motivate improvement. D. Avoiding feedback to prevent discouragement. 20. What does the rational use of osteopathic manipulative treatment mean in clinical practice? A. Using OMT for every patient regardless of diagnosis. B. Applying OMT appropriately based on clinical indication, evidence, and patient-specific factors. C. Never using OMT in conjunction with other treatments. D. Using only high-velocity, low-amplitude techniques. 21. In curriculum development for osteopathic medical education, what is the purpose of integrating osteopathic principles throughout all years of training? A. To separate osteopathic content from other medical knowledge. B. To reinforce the holistic, integrated approach to patient care throughout professional development. C. To reduce the amount of scientific content. D. To focus exclusively on musculoskeletal medicine. 22. Which evaluation method is most appropriate for assessing a student's competency in performing cranial osteopathic manipulative medicine? A. Multiple choice written examination only. B. Direct observation with structured evaluation of palpatory findings and technique performance. C. Self-assessment without external validation. D. Computer-based simulation exclusively. 23. What is the primary purpose of the AOA's osteopathic oath? A. To differentiate osteopaths from other healthcare providers. B. To establish ethical and professional commitments of osteopathic physicians. C. To limit practice to manipulation only. D. To exclude evidence-based medicine. 24. According to best practices in osteopathic medical education, how should students learn about counterstrain technique? A. Through lecture alone without demonstration. B. Through a combination of didactic instruction, demonstration, supervised practice, and feedback. C. By reading textbooks exclusively, without any faculty guidance. 25. What does SOAP stand for in the context of osteopathic medical documentation? A. Standard Osteopathic Assessment Protocol. B. Subjective Objective Assessment Plan. C. Structural Observation and Palpation. D. System of Approved Osteopathic Procedures. 26. In the context of the single accreditation system, what does ACGME stand for? A. American College of Graduate Medical Educators. B. Accreditation Council for Graduate Medical Education. C. Association of Clinical Graduate Medical Examiners. D. Advanced Council for General Medical Education. 27. Which principle of adult learning suggests that osteopathic residents need to understand how OMT skills will be applicable in their chosen specialty? A. Adults prefer abstract theoretical knowledge over practical application. B. Adults are motivated to learn when they see relevance to their professional roles. C. Adults learn best through passive observation. D. Relevance is unimportant in adult education. 28. What is somatic dysfunction in osteopathic terminology? A. A psychiatric disorder. B. Impaired or altered function of related components of the somatic system, including skeletal, arthrodile, and myofascial structures. C. A surgical complication. D. A laboratory abnormality. 29. When evaluating the effectiveness of an osteopathic residency program, which outcome measure is most important? A. Number of publications by residents only. B. Board certification pass rates, patient outcomes, and resident competency in osteopathic principles. C. Program revenue generation. D. Number of manipulation techniques taught.